Welcome to Medical Ward BSN 3E Group 3, Second Rotation NCM 116 RLE, Nursing Care Management 116 RLE, Medical Surgical Nursing 2, Virtual Clinical Duty. This is our third week, and of course, we'll have to have our case scenario, and our focus is patient GH diagnosed with cataract. But before that, let me share this premise with you. I am here for you. It's literally my life's work to help you grow. And also will be guided with our learning outcomes for this week. On completion of this case study, student nurses will be able to first build knowledge related to the patient's medical experience. Second, continue to develop a comprehensive assessment and monitoring skills. Third, recommend nursing interventions based on the case presented. Fourth, define the roles and the contributions of student nurses in the care of medical patients. And fifth, justify optimal therapy based on the current understanding of the case. So this will be the guidelines, or this will be our focus, and at the same time this will be evaluated at the end of our case analysis. And also, for the reminders of the instructions, please allow me to read this. All critical thinking questions presented within or after the case applies to this case study. You have to create a brief and to the point responses, no flowery words. When asked to provide several answers, it must be listed in order of priority or level of significance. Base all your answers on the data that is presented and do not assume information that is not provided in the case. Further, please follow the format of your output, especially on its font style, font size, paper margin, paper size. And I know you know it already. Save it as PDF file and submit all your requirements per group on date specified as its deadline. Send all your requirements via the official email address of your clinical instructor. It is advised that you will submit all your requirements on or before the set deadline of submission. Furthermore, kindly follow this format in saving your requirements for easier monitoring. For daily requirements, that's example is Abang underscore Joseph underscore W3D1 underscore NCM 116 RLE, and of course W3D2 underscore NCM 116 RLE for day 2. And for weekly requirements, Abang underscore Joseph underscore W3 underscore NCM 116 RLE. Let's now have your case scenario of patient GH with cataract. Patient GH is a 55 years old male, married, a Roman Catholic in faith, a casual government worker of the city local government unit, and is presently residing at Barangay Canituan, Cagayan de Oro City. Patient GH was previously diagnosed with cataract, senile immature in his both eyes, and has underwent phacoemulsification with intraocular lens implant on his right eye only. Currently, patient GH sought medical intervention at the outpatient department of Maria Reina Xavier University Hospital for his itchy, painful, and teary eyes, and was advised for an admission at the ENT unit of the hospital for further evaluation of the case. Diagnostic tests was done, and it was ruled out that patient GH has cataract senile mature OU and was advised for another phacoemulsification with intraocular lens implant for his left eye. There was no known family history of DM, hypertension, cancer, or any heart ailments within his family. Prior to the scheduled surgery, patient GH vital signs are as follows: blood pressure of 112 over 72 millimeters mercury, pulse of 71 beats per minute, respiration of 16 breaths per minute, and temperature of 99.5 degree Fahrenheit. Diagnostic tests were ordered and conducted to patient GH, and results showed in his visual acuity test that his right eye has an accurate acuity, while his left eye showed inaccurate visual acuity. Tonometry test was also performed, and results showed that his right eye has 12.2 millimeters mercury, while the left eye has an unrecordably low pressure. While waiting for the scheduled operation, the physician ordered the following drugs to patient GH: betamethasone 1%, 2 drops left eye OD; cyclopentolate 1%, 1 drop left eye OD. Teachings were reinforced to patient GH, and preoperative checklists were secured prior to the operation. Patient GH was transferred from the recovery room to the medical unit of the hospital for further monitoring after the operation. There were no untoward reactions noted, and a day of being admitted in the unit, the physician made a may-go-home order. Discharge instructions were given to patient GH and to his significant others, and validations were performed about the instructions given. Let's now have your high 5 critical thinking questions. Number 1. Define cataract and a group of conditions that can cause it. Again, define cataract and a group of conditions that can cause it. Number 2. What are the different types of cataract? Differentiate its cause. Number 2. What are the different types of cataract and differentiate its cause? Number 3. What are the early signs and symptoms of cataract? How about the late manifestations? Again, number 3, what are the early signs and symptoms of cataract and how about the late manifestations? Number 4, prior to the discharge of patient GH, what discharge teaching should you focus? Number 4, prior to the discharge of patient GH, what discharge teachings should you focus? Number 5, the last number, patient GH underwent a surgery to remove the opaque lens. Will there be any chance of recurrence? Explain your answer. Number 5, patient GH underwent a surgery to remove the opaque lens. Will there be any chance of recurrence? Explain your answer. So of course you have to answer the 5 critical thinking questions, and of course that will be submitted at the end of the week. For the daily requirements, of course, for day 0 Sunday, case scenario loading. Day 1 Monday, basic requirement includes your GOS ODPA Survey 1 Nurses Notes FDAR 1, initial knowledge about the case, physical assessment, pathophysiology, diagnostic tests, and of course your drug study. For day 2 Tuesday, the basic requirement includes your SO, DPA Survey 2, Nurses Notes FDAR 2, weekly evaluation, reflective journal reading, critical thinking answers, and of course you have to have the initial knowledge about the case that includes the problem lists, nursing care plan, and of course the discharge plan. For the weekly requirements, this will be the flow of your case analysis that includes your introduction, nursing health history, physical assessment, anatomy and physiology, pathophysiology diagnostic tests, drug study problem lists, nursing care plan, discharge plan, learning outcome, and of course your references, and that has to be on an APA style. Deadline of submission for day 1, the deadline is March 15, 2021, Monday, 11:59 p.m. For day 2, deadline is March 16, 2021, Tuesday, 11:59 p.m. And of course for the week 3, that's week 3. Week 3, that should be March 20, 2021, Saturday, 11:59 p.m. We are all on our own journey, but in this class, we all need one another and will help one another grow. These are my contact details, my email address, my cell phone number, my social media accounts. This has been Joseph Bahian Abang at your service to make your best even better. To God be all the glory.